Hi, I'm Sydney, and I am the Director of Marketing here at AxisCare. And I am sitting down with Dave Tasto, the President and owner of Assisting Hands in Boston Northwest. And I am so excited to talk to Dave about how his team significantly decreased their hospital admission rates, combining his thriving at home approach and using AxisCare to track and measure their success. Dave, how are you doing?
I am wonderful. Thank you for the opportunity, Sydney.
Yes, well, we're so excited to have you, Dave. And tell us a little bit more about your agency there in Boston.
Sure. We started our business a handful of years ago and are very excited to be impacting the lives of clients and families in our area. I'm very proud of our office team, but also our caregivers who are directly impacting the lives of family members and with their big hearts working hard throughout the pandemic, helping keep our clients healthy. We do support clients in the suburbs of Boston, mostly north and west of the city.
Well, Dave, let's dive right in. You have been a longtime user of AxisCare. Can you tell us a little bit more about why you chose AxisCare and how long you've been with us?
We're in our fourth year and very excited about tracking hospitalizations and are particularly fond of the mobile app for our caregivers and the ability for our team to capture the care notes electronically and provide them real time to families wanting updates on how mom or dad are progressing.
Yeah, well, Dave, from our conversations, it is just so clear that you have a passion for home care, a passion for seniors being able to age in their homes and how important that is not only for the client, but also for families. So, where did this passion come from? You've written an entire book about this passion and keeping clients out of hospitals. So, where did that passion initially stem from?
My entry into home care started after being inspired by caregivers who were caring for my grandmother during a hospice period. I was able to meet those caregivers when traveling back to Minnesota for my grandmother's funeral. They not only attended her funeral, having only worked with her for a few weeks, but they told me stories and how they were able to keep her smiling at such a difficult time for my grandmother, but also my mom. That just really touched me and got me more into what home care and caregiving was all about. In home care, though, as you mentioned about aging in place, I've seen firsthand how individuals can age in place, but maintaining and managing your health at home is a key piece for staying out of the hospital or rehab facility. As you know, hospitals can be very difficult, expenses, there can be unintended consequences, complications, and so forth. But as far as getting into the hospitalizations, I would say that last year during the pandemic, we did see some of our clients that had, like a low triage level go on pause. And they suspended services with us and moved in with a family member moved in with them, just to balance the risk of, getting exposed to the virus and so forth. But those family caregivers, they're providing a lot of support even these days, but they don't have the formal training that our professional caregivers do. Many are juggling home, work, and they're in that sandwich generation where they have maybe children at home and they're also caring for their parents. Well, our care team at Assisting Hands does a lot to keep individuals healthy. Many of these things can be and are being done by family members, though. Our trademarked, as you mentioned, our trademarked Thriving at Home approach is aimed to help those family caregivers with the tools and techniques to help keep their loved ones healthy at home. I wrote that book really to help those family caregivers do those non-medical interventions. Folks don't have to be nurses to know what to do at home to keep their loved one out of the hospital. And I want to say, though, Sydney, hospitals can provide the best care around. So it's not as if we're disparaging hospitals. What we're trying to do is avoid and prevent some of those unneeded trips to kind of avoid, that crisis moment, do everything we can to prevent an escalation that's needed. Mm-hmm. So I wanted to write the book to share the knowledge that our team does on a daily basis, but share that with family caregivers. Yeah. In logistics world, that last mile, is needed to get that package out to each person's home. Mm-hmm. In home care, that last mile in preventing hospitalizations really goes through a family caregiver. As much as our team might be with a client for 8 or 12 hours a day, after they leave, if something happens, maybe a client trips or falls in the evening, or something doesn't get escalated appropriately overnight, that client could end up in the hospital. And that's really what we're trying to prevent. So the book is really intended to promote awareness and options for getting support at home.
That's incredible. Yeah, well, I have read the book and many of our team members have as well. And I love the approach you take and just how simple and digestible it is. So driven by this passion, what specific steps did you take and what approaches did you put into place in your day-to-day that have made an impact?
As long as the home is a relatively safe environment, to help keep our clients at home, we have to help them and their families manage aspects of their health at home. And that includes knowing for their specific condition, what is normal, what can they expect. Some of our clients have, comorbidities, which means they have multiple chronic conditions at the same time. Well, when those come together, what is common for a certain person that might have congestive heart failure, but also diabetes at the same time? We have to monitor the blood sugar levels for someone with diabetes. But when we are monitoring that, we see that their blood sugar level isn't in the right range, and we take the non-medical intervention, maybe giving a glass of orange juice, whatever their physician or doctors might have prescribed, and it doesn't change. Well, then we know that we're moving into an abnormal area. And that's cause for escalation to other healthcare providers to understand what can be done before it turns into a crisis and a trip to the hospital may be needed.
Yeah.
So we're managing all aspects of health at home, not directly through ours, but through the right appropriate escalation and communication with other healthcare providers. And we cover in the book all of the leading conditions that drive readmissions to hospitals. And those include COPD, or chronic obstructive pulmonary disease, diabetes, stroke history, as well as heart failure. And in the book, there includes, escalations of what to monitor for those given conditions, and when a trip might be still needed to go to the hospital if something is out of control. Our approach is to really provide the highest quality of care. And to us, that means that we need to manage those aspects of our clients' health at home to help keep them out of the hospital. But we needed a system in place to help us track performance at the company level, but also impact quality of care client by client. We didn't have a system in place to track that performance for that critical quality of care metric, which is our readmission rate. Our trademark thriving at home approach permeates all aspects of our business now, from gathering previous hospitalization information during new client assessments to creating individualized care plans for our clients, also tracking all incidents and falls, which are the leading indicator for hospitalizations. Also being able to report our readmission rates now at that aggregate level as an agency. Mm-hmm. We're also working now towards more proactive measures on monitoring falls and other leading indicators to take initiative on care plan updates for clients who are at increased risk levels for hospitalizations. Again, all towards the objective of keeping our clients healthy at home and out of the hospital.
Yeah. So before using AxisCare's hospitalization tool, how were you tracking those readmissions and determining your rates? And were there any frustrations with your previous way of tracking?
We were tracking and noting, I would say more noting, client hospitalizations at the client level. Again, it was just in our notes. There was no log in terms of where we could report on this data. Everything was a little bit ad hoc in our system. It was noted, but it was ad hoc. There was no way to report on it. Our team had a hard time finding it as far as where that information was. Was it in certain client notes, in a profile, or where it might be? We were able to use the standardized, way to calculate our rates, as well as the standard reporting out of AxisCare to monitor very quickly, easily now across all of our clients in different ways, how we want to sort them as well through the client classes that we're using, whether they might have a certain chronic condition or others. We can kind of compare rates across different classes of clients even as well now.
Well, Dave, your team in your agency, you were one of the first agencies to start using our hospitalization tracking tool. So as a pioneer and as you started to implement these tools, how was that process and what impact have you seen?
Well, immediately, as you said, I was looking for that solution to really track our performance. But so we enabled it immediately, system-wide, and started tracking immediately. There is some work to get started when you're tracking, and we did have to go client by client to enter some of the previous hospitalization information. Yeah. We had in our notes, so we did have to go through our profiles and find that information to load it. We also now ensure that new clients are assessed for the hospitalization risk when we start on with them and get their previous hospitalization information upon starting up a new client. Our triage levels now take into account, the level of risk for hospitalization, but we had to gather, when they were last in the hospital, when they went into the hospital, if we had that data, and the reason for going into the hospital. That data is critical for tracking your readmission rates for the same reason, for other reasons. So if they go in for a different reason, you want to know that so you're able to affect it. The tool is very helpful in that it highlights information gaps, alerting our office team to any information that's missing, particularly that initial prior hospitalization data. As their focus, our office team is focused on quality of care. They immediately embraced the tool when we rolled it out. As we want the best for all of our clients, it is just a tiny amount of extra effort for a major benefit to our clients and families and even our partners.
So as you began tracking this data in the tool, what key performance indicators did you have your eye on to measure and track the success?
Falls are the number one leading indicator. Tracking all incidents, though, even if they don't result in a hospital admission, is critical. Care escalations are another area that we're looking into. When caregivers call the office or escalate to our care advocates or just seek additional support, these are areas that we're still investigating and improving in our tracking and insights on risk level.
So since implementing both your thriving at home approach and using AxisCare to measure your success, what impact as a whole have you seen on your business?
Well, we regularly monitor our readmission rates and are now tracking in the very low single digits. But as far as the results of the thriving at home approach, how it really shows up, and that focus on keeping clients out of a hospital is really in our client satisfaction. Our client satisfaction data is now very strong, and we're winning awards in the Boston area as a provider of choice. Our caregivers are also happy. They're getting their supplemental training, but also they have more consistent schedules with their clients remaining at home and not going into the hospital as much. We're also receiving referrals from new partners who see our focus on hospitalizations and driving high client satisfaction and caregiver satisfaction as true differentiators in the area.
All right, so wrapping up, Dave, what are one or two actionable items that home care agencies can take away from your experience?
In home care, we're in the business of preventing hospitalizations. I would start by tracking all incidents and hospitalizations immediately. Although the data is after the fact and you'll understand how you're doing or how your results have been to date, it is very important to start tracking to have that data. But what you can also do today is you can start to take proactive measures that can impact your rates as well, ahead of gathering all the statistics and data to report out on your rates. Update your intake process to capture hospitalizations, specifically tailor your care plans to address potential causes. And lastly, train your caregivers on what to look for and to flag causes for hospitalizations that could lead, or prior to a crisis event happening.
Mm-hmm. Well, Dave, thank you so much for your time today. As always, it's been such a pleasure. And if anyone listening would like to learn more about AxisCare's hospitalization tracking tool, you can visit our website for more information. Dave, how can they learn more about you and where can they purchase your Thriving at Home book?
Thank you, Sydney. I appreciate the opportunity today and hope my experience helps agencies out there, but also helps keep clients healthy at home and out of the hospital. To find more about our Thriving at Home approach, you can visit our website at assistinghands.com/BostonNW. To find information about the book, Thriving at Home, a handbook for preventing hospital stays, you can find it on Amazon or on our website, thrivingathomehealth.com. Thank you again.
Yeah, we'll talk to you soon, Dave.